Hello everyone, how we doing? This lesson is going to be talking about different types of wounds. There are two different types, open and closed wounds. A wound is an injury to soft tissue area of the body. Closed wounds, it develops from a hard hit or a forceful blow to the body, does not visibly bleed, and it does not break the skin. And we know more so what a closed wound is. Example is a bruise. It's known as a contusion. That's the name. When the body is bumped or hit, there's a pretty sick picture of a bruise, also known as a contusion. And usually the bleeding is not visible. So now on to open wounds. There are different types of opened wounds. Cuts, scrapes, burns, and open wounds are usually visibly bleeding and it does break the skin. One type of an open wound is called an abrasion. For example, a scrape, as you can see in the picture, something that rubs against the skin. Usually a person does not bleed much, but there is damage to the capillaries of the skin. Another type of open wound is a laceration. It's a cut in the skin by a sharp object. If you cut yourself while you're cutting, maybe you're cutting vegetables or something like that, you can see in the picture. And with a cut or a laceration, a person can bleed a lot or not as much at all. An avulsion is another type of open wound. A cause is a portion of the skin is partially or completely torn right off. An example would be an amputation, and there's often significant amount of bleeding, lots of bleeding. Then we have a puncture wound, another open wound. A pointed object pierces the skin, like if you were to step on a nail or get a nail in the foot, that would be the example in the picture of that x-ray there. And usually you do not see much bleeding a lot in a puncture. So those are the different types of wounds, open and closed.